Have you ever felt a disconnect between your clinical recommendations and your patient's actual needs? Or maybe you've seen a patient struggle to follow a plan that just doesn't fit their lifestyle or preferences? If you're nodding your head, you're not alone. Today we're diving deep into the often overlooked power of patient autonomy and how we, as SLPs, can make a real difference by embracing patient-centered care. Hi, I'm Teresa Richard. I've been a medical speech pathologist since 2008. I'm a board-certified specialist in swallowing and swallowing disorders, and I'm the founder and CEO of the MedSLP Collective and MedSLP Education. Author of the best-selling books, You're Having Trouble Swallowing, and host of the Swallow Your Pride podcast, which has over 5 million downloads. Welcome, I am so glad you are here. Is anyone even listening? Dysphagia adherence and the patient perspective. If you had to guess, how many patients would you say actually adhere to our dysphagia recommendations? What percentage of those who we lend our time, effort, and expertise actually do what we think is best? The answer? 51.3%, according to Kreckler et al. In 2018. That's right, only about half of our patients actually follow our recommendations for dysphagia management. Think about that for a second. All those carefully crafted plans based on countless evaluations and endless research, and they're ignored. But why? Because sometimes, just sometimes, we forget to see things from our patient's perspective. Imagine a young athlete who suffered a traumatic brain injury. After weeks of rehabilitation, he's finally ready to return home. But with a strict dysphagia diet that includes thickened liquids and pureed foods, he feels frustrated and isolated. Unable to enjoy meals with his family or participate in social gatherings. He doesn't truly understand why the recommendation was even made because he has no history of choking or pneumonia. He starts to skip meals, loses weight, and becomes withdrawn. Now picture yourself as that patient in the hospital after a suspected stroke. You're exhausted, hungry, and thirsty after a battery of tests. The SLP arrives to assess your swallowing, and after a single 3-ounce water swallow test, tells you are NPO until further testing can be done. Maybe tomorrow. You try to explain that you just cleared your throat because you were thirsty. Can I just have a little bit of water until this other test can be done, you ask? But the SLP insists it's protocol, and there's nothing she can do. How would you feel? Probably unheard, frustrated, and maybe even a little angry. I know I would. Both of these stories highlight the crucial need to understand and respect our patients' perspectives. We need to ask ourselves, are we truly listening to our patients, addressing their concerns, and understanding their needs? From paternalism to partnership. The good news is that healthcare is evolving. We're moving away from a doctor knows best mentality and embracing a more collaborative approach with our patients. This means recognizing that patients are the experts in their own lives and that their preferences, values, and goals should be at the center of the decision, not as an afterthought. I'll tell you about a patient that I had who has a progressive neurological disease who is facing difficult decisions about his future care. Instead of simply recommending a feeding tube, I engaged in a thoughtful conversation with the patient and his family. They discuss his values, his fears and hopes, and the potential benefits and burdens of different options. Together, they create a plan that prioritizes the patient's quality of life and aligns with his wishes, but also aims to keep him safe and thriving for as long as possible. This story exemplifies the power of shared decision-making and the positive impact it can have on patient well-being and the overall care we provide. But how do we actually put this into practice? Here are 3 key strategies. Engage in shared decision-making. Have open and honest conversations with patients about their condition, the potential risks and benefits of different options, and what matters most to them. Work together to create a plan that aligns with their goals and values. Remember the story about the patient who failed the 3-ounce water test, but just wanted a sip of water? What if the SLP had taken a moment to understand the patient's perspective and offered a compromise like small amounts of water or even ice chips after good oral care as a temporary measure until further testing could be done? Provide tailored education. Empower patients with the knowledge they need to make informed choices. Explain the rationale behind your recommendations, address their concerns, and answer their questions in a clear and understandable way. Don't just say, it's protocol. Explain the reason behind your recommendations so they are not left lost in the dark. Respect patient choices. Even when patients make decisions that differ from your recommendations, respect their autonomy. Support them in their choices and continue to provide compassionate care, even if it looks different than you initially envisioned. There is no reason to discharge a patient as a result of their preferences, unless those preferences are to discontinue therapy. Then you might have to say goodbye. But otherwise, you have a role and a responsibility to stick by them, continue to educate, and guide them towards their goals. This is where it gets really interesting. If you're finding this information valuable so far, make sure you hit that subscribe button and the notification bell. We'll be dishing up more evidence-based information and helpful insights in future videos. Have you ever encountered a patient who was adamant about eating something you considered unsafe? Maybe they were craving a juicy burger despite needing a modified diet, or they insisted on drinking thin liquids even with a high aspiration risk. Share your experiences and how you navigated those tricky situations in the comments below. How did you balance patient autonomy with your clinical recommendations? Let's learn from each other. And don't forget to stick around to the end. I've got a fantastic free resource waiting for you. You're gonna love it. The power of asking the right questions. To truly embrace patient-centered care, we need to ask the right questions. Dr. Atul Gawande, in his book, Being Mortal, offers these insightful prompts. What is your understanding of the situation and its potential outcomes? What do you want most? What is most meaningful to you? What are your fears and what are your hopes? What are the trade-offs you are and are not willing to make? What is the course of action that best serves this understanding? By asking these questions, we can gain a deeper understanding of our patients' perspectives and tailor our recommendations accordingly. Remember, our patients are not just cases or diagnoses. They are individuals with unique voices and valuable perspectives. The future of healthcare is patient-centered, and by embracing autonomy, engaging in shared decision-making, and continuously adapting our approach to meet the evolving needs of our patients, we can support a more compassionate and effective healthcare system as it evolves in the future. An 85-year-old woman with a history of stroke was struggling with a recommended diet of pureed solids with mildly thick liquids. Rather than simply emphasizing the risk of aspiration pneumonia, the SLP took the time to understand her perspective. She learned that the patient felt the food she was getting was baby food and made her feel embarrassed and childlike. She missed the taste and texture of real food and the social aspect of sharing meals with friends. Recognizing these concerns, the SLP collaborated with the patient to find solutions. They explored options for modifying her favorite foods to be safer to swallow, like finely chopping or mincing instead of pureeing. They also discussed ways to improve the visual appeal of her meals and maintain social dining experiences. By acknowledging her feelings and priorities, the SLP fostered a sense of partnership and empowered her to make choices that balance safety with her quality of life. Congratulations! You're now equipped to be a champion of patient autonomy and a leader in patient-centered care. Remember, let's listen to our patients, empower them, and work together to achieve the best possible outcomes. Ready to become a true champion of patient-centered care and transform your dysphagia practice? Join the Medical SLP Collective. It's a supportive online community where you can connect with fellow SLPs, access evidence-based resources, and dive deeper into the world of dysphagia management. As a special bonus for watching this video, I'm offering a free health literacy resource to help you help your patients access, understand, and use information about their health. Click the link in the description to check it out. Thanks, and I'll see you in my next video.